Hey everyone, welcome. I'm super excited you're here. I'm going to go over the 6 overlooked causes of digestive disorders. Basically, I'm going to share with you what I wish I knew about 4 years ago when it comes to digestion, like IBS and leaky gut, to help you along in your healing journey. Everyone's in a different place with their symptoms. We have to honor that. Everyone has a different starting point, and everyone's unique. But we all have a similar problem and a lot of the same root cause issues, but we just manifest symptoms differently. So we're going to get into those different aspects of root cause issues to digestive disorders. But again, just welcome. I'm super excited that you're here, and let's go ahead and get going on this webinar. So just a little bit about me. I'm the clinic director at the Tennessee Center of Integrated Medicine. So I do have a brick and mortar practice. So I spend about a third of my week in a brick and mortar. I see patients in person with functional medicine, chiropractic, acupuncture. Then I spend about a third of my time doing virtual practice, virtual consultations, helping people along with their health journey, especially IBS and leaky gut and other digestive disorders. Then I spend the other third of my time doing things like this. So I like doing webinars, I like doing educational material, and just running the clinics and doing those types of admin duties. So that's usually how my week is split up. I've learned all across the country from different docs. Basically, I've compiled what I've learned from them, and I create presentations, use that clinically to help other people going through the same problems. So first, why do I care about digestive disorders? Why do I care about helping people with getting to the root cause of digestive disorders? Primarily because it affected me so much in the beginning. I was dealing with IBSD or irritable bowel syndrome with diarrhea. I dealt with this for years, and I had a lot of symptoms associated with it. It's one of those things. I was going to the restroom up to 8 times a day. I remember getting up, getting ready to go to work, going to clinic, and I'd be in the bathroom about 4 times before I even left the house. In about an hour and a half. It's crazy. And there's a lot of other symptoms associated with the typical diarrhea, the gas and that kind of thing. But those symptoms being like what I call like the blue funk, or some people may want to consider it kind of like depression, but I don't know if you want to. It's one of those things that I'm not really depressed, but I just don't know what's wrong with me, and I like to call that the blue funk. I had severe body odor with exercise. Associated with the clinic, I just had a lot of chronic stress in my life. We're expanding, trying to decide what we're going to do with the clinic, and there's just a lot going on with that. Like I said before, the typical digestive disorders or digestive symptoms I have is like smelly gas and multiple bowel movements per day. And I was having a lot of skin symptoms, so acne was a big one for me. And I was starting to develop just this random, non-specific joint pain. So I would adjust patients, and my wrist would hurt, or I was having knee pain, or my right low back would just start hurting for no reason. I didn't lift or hurt it or strain it. I was just having these weird oddball symptoms, and it just seemed all over the place. But really, what was going on is just my digestive system was a wreck. So basically, I was able to heal that and get on the right track. I'm going to go through some of these steps with you here in this webinar. But I know where you're at. I've been there, and that's the reason why I become passionate about really helping people with digestive disorders. So let's go ahead and move along a little bit. So there's my skin. That's kind of the peak of it. Just the acne and just the inflammation really is what strikes me with this picture. So and that was really my breaking point. Waking up every morning and just looking in the mirror, and it's just like, daggone, like what is going on? I don't feel good. I got this blue funk. My digestive system's a wreck. I got joint pain. I have really no energy. Living on caffeine day to day just to try to survive. So I really had to start digging and actually find the root cause issues of what was going on. And I'm going to share that with you here in just a little while. So I want to ask you, why are you here today? I mean, you heard my story. I've been there. I know what the digestive dysfunction feels like, IBS, the gas and just not knowing where the bathroom's going to be out in public. I had low energy. I knew my goals, but why are you here? Is it because you just want more energy to do what you want to do? Do you want to play with your kids a little bit more, be a better mom, be able to vacation, run a road race, or some of those are your goals? Maybe it's the brain fog. Maybe you just want to you just want that brain fog to lift and just feel better, have that mental clarity, or you're trying to go for a job promotion. You just don't seem to have the energy to do that. Um, so it's just very important to kind of grasp onto what's your goals, what's your visions, what are you trying to accomplish. I like to say that a person who's healthy has 1,000 dreams, but a person who's not healthy just has one dream, and that's to be healthy. And when you give someone their health back, they can go after basically all the dreams that they want to. And that's our main focus with functional medicine is just trying to get to the root cause issues. That way you don't have to deal with these kind of symptoms lifelong and actually enjoy your quality of life. So basically, this workshop's for the person that really wants to be listened to. That's a big complaint with Western medicine, is that our doctor just spends 5 minutes with me and they don't care. So functional medicine is for people that want to be listened to and deeply cared about, and they want to successfully recover from their health challenges, want to create practical and sustainable health habits, really get to the root cause issues of why they're feeling the way they do, and just spend less hours researching online. I mean, Dr. Google's out there, and you could basically, it's a time suck. You could be spending 10 hours a week just trying to research IBS or leaky gut or Crohn's or whatever it may be, GERD, acid reflux, um, and what could be causing your symptoms. And you just don't really have a roadmap. So this is for people is just, I want to streamline, I want to get things done and accomplish and get feeling better. So by the end of this webinar, you're going to uncover, or we're going to uncover the 6 overlooked causes of digestive disorders, and really those boil down to what we call sensitivities, deficiencies, and toxicities. And we're going to see how we uncover those, and wrap that here in just a little bit. We're going to show you the exact method we use to help even the most challenging cases. And we're going to see why conventional approaches really aren't working. And we're going to give you a proven strategy for long-term health. So kind of like what I was talking about earlier, we want to begin with the end in mind. What's your goals? What's your vision? I've never met someone that wanted to have poor health, live in a nursing home, not ever play with their grandkids in the last 10 years of their life. So you have to be very clear of what you want. Do you want to be energetic, motivated, be happy, have good mental clarity, calm, confident, and balanced? So you have to hold on to those, but you have to see where you're at right now. Most people watching this webinar, they're tired, bloated, crampy. Maybe they got Crohn's, IBSD, IBSC, frustrated. They're emotional, roller coaster. They're fatigued. They got all sorts of skin issues like psoriasis, eczema, and acne. But then we need to bridge the gap. I mean, like I said before, everyone has the goal of I want to be healthy. I never met someone that says I wish I had crappy health and just wasn't going to have a successful life as I go older. That's never a goal of anybody. Everyone wants to be happy, healthy, and have a good life. But how are we going to get there? So we gotta be thinking about that. So I want to show you what chronic disease and chronic symptoms look like. We're all healthy to a certain point in time. Most of the time, we hear from patients that one day I was healthy and then one day I just wasn't. You always feel like the diagnosis comes out of nowhere. It usually starts with a trigger, which could be a food intolerance, sensitivity, or a virus, bacteria, or the subsequent response to these viruses or bacteria. For others, it could be stress. Most conditions or disease is stress mediated. When you really slice it down, having a virus is a stress on the body. Having a poor relationship with your significant other is a stress on the body. A stressor can really be anything. It could be mental, emotional, or biochemical. Then there's a giant pre-symptomatic phase. When you don't have symptoms, during this phase, your immune system is trying to take care of something. Then we hit that dynamic symptoms threshold. This is when you start to maybe get small symptoms. So we're getting into this orange phase here on the graph. We need to listen to our body's whispers before we have to listen to our body screams. And we're all guilty for ignoring these whispers. Over time, we get degeneration, the conditions worsen. This is usually the first point where you're evaluated, and that's usually up here in the symptomatic stage in the red phase. So over time, we get degeneration, the condition worsens. This is usually the point where you're evaluated or the first time you find out you have X, Y, or Z condition. True health comes from prevention of these things. Here's an analogy. Imagine inflammation in your body is like rain. Now imagine the different organs in your body are like buckets. Some are small like your thyroid, whereas some are big like the liver. The smallest buckets are going to fill up first. So the thyroid is going to fill up first and it's going to get the most attention, aka have the most symptoms. Does this make sense? But if we don't stop it from raining, the other buckets are going to start filling up too. So you got to see why this approach needs to change. For example, Hashimoto's is an inflamed autoimmune disease. The thyroid has low tolerance to toxicity and chronic stress. It fills up quickly. But the other organs have a bigger reserve, like the liver, the brain, and the heart. At the end here is in, at the end here in the red and purple, the dynamic phase, there are some type of symptoms you're experiencing, you're not getting better. We want to find out what that trigger is and eliminate it. By the time you get a diagnosis and by the time you have a goiter or thyroid nodule, you're all the way to the end process. We want to prevent this from happening. You may ask, what triggers thyroid disease? Thyroid disease is oftentimes due to autoimmune disease, and autoimmune disease is triggered by stress. This stress could be a divorce, could be a financial stress. Any acute or chronic stress weakens our immune system, but it also causes our immune system to respond inappropriately. And as a result of this, we develop autoimmunity. There are also emotional reasons for autoimmunity. If your body is wrongfully attacking itself, where you are wrongfully attacking yourself, that happens a lot. There's also an emotional connection to autoimmunity. We don't want to just look at the lab work and ignore what dialogue's going on inside your head. We have to also look at the emotional component. I can say or do things that make you happy, and when you're happy, the chemistry of your blood changes. When this happens, you're healing and you're regenerating. How many of you feel better on vacation? I know I always did. What did I do? I changed my environment. I changed how much sunshine I was getting, why I woke up in the morning. Then we come back and go to a stressful environment and we don't feel good anymore. 2 years in a row, I noticed dramatic changes in my bowel function when we went to Florida. I was able to disconnect from running the clinic, got more sleep, got more sunshine. Your environment, mentality, physically, and biochemically can put your body in a long-term negative stress response. It's like trying to fix the car to compensate for a bad driver. It's like giving a speeding ticket to the car instead of the driver. So let's look at the 6 overlooked causes of digestive disorders. And like I said before, this boils down to sensitivities, deficiencies, and toxicities. First is just digestive sequencing. Second is intention. Third is low digestive enzymes. Fourth, food sensitivities. Fifth is leaky gut. And sixth is stealth infections. So let's break these down. So digestive sequencing is basically one step has to be fully completed before the next step does. Digestion starts in the brain. So you have to be in a low stress response for you to actually produce digestive juices, enzymes throughout the digestive tract. And this happens via the vagus nerve. So if you look up here, the brain actually connects down to the gut through the vagus nerve. And if we're relaxed and in a happy, joyful state, we get hungry and we create digestive juices and we can actually start digestion. But if we're stressed out, in a sympathetic state, then that vagal tone is what we call it, decreases, and then we're not going to produce the digestive juices that we need. So being in a low stress response is absolutely critical, the very first step to eating a meal. Second is actually chewing. So we put food in our mouth, we got to completely chew it, not inhale it, and actually start the digestive process that way. And actually, third, we just got to pick the right food. So if we decide to go out to fast food and eat that 5 days a week, you're going to destroy your body and your health. Once that's done, the only control you have over digestion is the emotional response, the stress response that you're in when you go to eat, and how well you choose it and the food that you put in. After that, after you swallow that food, you have absolutely no control of what's going to happen and what it's going to do to your body. So you have to be aware of that. So after we swallow the food goes down into the stomach, starts digestion down here, and then it goes into these small intestines here, and that's where most of our nutrients are absorbed. And finally, it goes into the large intestine where a lot of the water is removed and we get the electrolyte balance and that sort of thing. And then finally, the food just is eliminated. So with sequencing, I just like to think of it like a car wash. So it's very important to do the right steps first. So if you go to a car wash, and in the order of the car wash was to put your wax on first, use the blow dryer, then rinse the car first, and the last thing you do is put the soap on it, you're not going to have a very good clean car. So it's important with digestion to really think about that. The first 2 or 3 steps is critically important to do first for you to have a good digestive process. Remember, again, I said low stress response, and then actually chewing your food. And this goes right along with it. So intention. So basically, what are you thinking about when you're eating your meal? I know I'm guilty of this myself, and just we're trying to get a lot of stuff done during the day. But we have to focus on our meals, and we have to give our work a break. And we don't want to be eating food in front of a screen. So the intention around our meals is incredibly important. And this was what I was talking about just a little bit earlier. So we have two main branches of the nervous system. The first branch is your sympathetic division, and that's your stress response. So back in the day, if you saw a lion, it would scare you. Your heart rate goes up. You're getting blood, spread it out to the legs and to the limbs, so you can run away. And basically, what that does, the activation of the sympathetic system, in the terms of digestion, takes blood away from the digestive organs. So you're not going to produce the digestive juices and enzymes to actually break down food. So we don't want that. We can't be in a stressful response. But the thing is, your body can't tell if you're running away from a lion or if you're still having that mental recall with the fight with your spouse or the fight with your boss or the argument you had with your brother or sister. They physiologically do the same thing to the body. So we have to be very cautious or conscious of what we're thinking about during meal times because we want this side activated. So this is the parasympathetic division, and this is the vagus nerve. So it starts right up here next to the brainstem, comes all the way down into your digestive organs. And when this vagal tone increases, it increases the amount of enzymes produced, gastric juices, and then we can actually break down foods and actually have a nourishing meal. Because it doesn't matter what you eat if your body can't break it down and actually extract the nutrients out of that food. So a big one. So going back to just the mental aspect of being in a stress-free response at mealtime, one of the best things you do is just deep breathing. So inhaling through your stomach, inhaling through your nose, a slow inhale breath, 4 seconds through your belly, and then a slow exhale, 3 to 4 seconds out, has actually shown to increase that vagal tone, increase that parasympathetic response, and help you digest food. So if you're in a stressful job or you just have a lot going on, just 5 minutes before you eat a meal, slow down, deep breathe, and just think of something positive, something that makes you happy. So just rest and digest. So in summary, really just the digestive systems where most mystery illnesses and symptoms start. Think of the 4 C's: choose, chew, chill, and cherish. Where you send flow is where you send function, and be grateful for symptoms because then we actually know what to do and how to fix them. But as you can see, not everything is our fault. Food has changed tremendously over the last 50 to 60 years. As you can see, back in 1950, here's a chicken and how big it used to be. But now we pump chickens full of antibiotics to make them grow big. So when you go to the grocery store, you have these big fat chicken breasts to cook at home, but they're not nearly as nutritious as what they used to be. And here's another one. I know many of you may have seen these kind of pictures. Just the amount of preservatives that are found within French fries and hamburgers and just processed foods in general. I mean, you can leave the stuff out on the counter for weeks and months and even years, and it just doesn't rot, and that's not real food. So that stuff that's inhibiting growth of bacteria on those foods is doing the same thing to the microbiome inside your stomach. It's killing it off. So it's incredibly hard on the digestive system to eat these kind of foods. So next, let's talk about low stomach acid. Another root cause issue is just low stomach acid, low digestive enzymes. So low stomach acid is incredibly important to fix because stomach acid kills off bacteria and pathogens that we may eat in food. And it also is the first step in breaking down protein. And finally, it reduces minerals, so like iron and selenium and magnesium. If you don't have proper amounts of stomach acid, you're not going to do those processes well. And being protein deficient is a huge risk factor for just overall health, immune health, osteoporosis, and so on. So as we age, stomach acid slowly decreases, and that actually produces symptoms of acid reflux. A lot of people think it's actually high stomach acid that produces acid reflux, but it's not. It's low stomach acid because you have this incomplete digestion of proteins, and that food actually kind of starts to rot within the digestive system, and it's very acidic, and it goes up into the esophagus and can cause GERD and acid reflux. Another root cause is food sensitivities. This is huge. So you have to know what food is healthy for you. Some people can eat gluten. Some people can eat dairy and eggs and wheat and all those different types of bad foods that we may consider. But other people, it's completely fine. So sensitivity testing is testing the part of the immune system called IgG. And this is delayed inflammation. So if you eat something and get a migraine 3 days later, you eat something and you get a rash or you break out with acne, or you get joint pain, those are possibly food sensitivities. So we have to give the immune system a break to allow the gut to heal and let symptoms, subside. And also we got to give the gut a break. So food sensitivities that spike a lot of inflammation, they're hard to break down. Your body doesn't break down pro-inflammatory foods that well, and that just wreaks havoc downstream. It can cause a lot of the gas and bloating, constipation, diarrhea, and so on and so forth. And next, this is the buzz term going around is leaky gut. But I'll give you a clue. Leaky gut is actually a symptom. It's an effect. It's not really a cause. Something else is causing leaky gut. So food sensitivities, lots of times, is a big one. Where we're at and our state of mind while we're eating, like we were talking about earlier, can cause leaky gut because if you're not producing the right amount of digestive enzymes, it creates a lot of inflammation in the digestive wall, and that can cause these gap junctions here. So these are called gap junctions in between these cells within the small intestine. So these guys just need to be right up next to each other, and it's like a selective membrane. Think of just like an opening and a gate. You should be able to allow certain things in and keep certain things out, and that's what the wall of the digestive system does. We allow nutrients and healthy things to come through, vitamins, minerals, carbohydrates, proteins, fats. Those all come through, don't create inflammation. But what happens is, a lot of stress, food sensitivities, eating a lot of processed foods, it creates inflammation around the intestinal wall. And these gap junctions, they break here. And then basically we can get mycotoxins, we can get bacteria, foreign particles, undigested foods, and they enter this part of the digestive tract. This is called the GALT, or the gut-associated lymphatic tissue. And this is where all the inflammation starts. And then basically it just wreaks havoc in the bloodstream. And that's when basically the root cause of pretty much all disease in the body, in the gut, basically travels around in the bloodstream. All that inflammation travels around, and that's where you get all these different kinds of symptoms associated with leaky gut. You get the eczema, psoriasis, Hashimoto's, acne, joint pain, and weight gain is a big one. Anytime you have a lot of inflammation, definitely in the digestive system, you're going to gain weight. Weight gain is a buffer against toxins. So if you're one of those people that, hey, I need to lose 15, 20 pounds, I've done everything, food sensitivities and just your state of mind can be a huge part of that. And we got to heal the gut first for you to be able to lose weight. So just to follow up on the leaky gut, just remember 80% of the immune system is inside the gut. So if you have an autoimmune condition, if you have Crohn's, if you have Hashimoto's, it's a gut issue. So we have to heal the immune system. And one of the biggies is the food sensitivity testing to help give the immune system a break and a chance to heal. So proper digestion is synonymous with a balanced immunity. Finally, the last cause of digestive disorders is stealth infections. There's an ecosystem within the GI system. There are trillions of microbes inhabiting our digestive system. These are vitally important to proper digestion, immune function, brain function, stress, antibiotics, frankenfoods, and other medications. They disrupt the ecosystem of the digestive system. This can allow for opportunistic bacteria, fungus, and parasites to overgrow or to invade. This leads to decreased digestive function. We can't break down foods because of the chronic inflammation. And it's critical to test for these bad bugs if you're dealing with digestive disorders. So this is where we use a test called a GI map. And we're going to show you that here in just a little bit. So let's go ahead and look at some case studies. I want to show you how we work through these cases and some of the lab work that we use to figure out IBS and Crohn's and acid reflux and all those kind of digestive disorders. So first one here, I would say 95% of the time we start with a food sensitivity test because like what we said before, we got to control inflammation within the GI system to give it a break. So this is actually mine. This is, like I told you before, with my symptoms. So here's the lab work that's following that up. So as you can see, dairy is a huge one for me. I need to stay away from gluten. So gliadin's the protein in gluten, and just the wheat markers are high too. Then eggs. See, I was eating eggs every single morning, and it was wreaking havoc on my digestive system. So I had to stop it. A couple more cashews, asparagus, and actually pistachios were kind of moderate, so I needed to watch those as well. So I did that GI map to see about the stealth pathogens in my digestive system. As you can see, I had a very high bacterial overgrowth within the GI system. So the Pseudomonas here, this E to the 7th power, was very, very overgrown. So E to the 4th, less than 1 to the E to the 4th is normal. So I almost had double of what I really should have, and we don't want that. So the opportunistic bacteria, these guys come up usually from like antibiotic therapy, chronic stress, eating a lot of bad foods. These are bugs or bacteria that live in our digestive system, and they're normal to be there, but they should be in check. They shouldn't be overgrown. And finally, I did a mold test. So this falls under the stealth pathogen as well. Did a mold test because I drank a ton of coffee. So you're thinking, what does coffee have to do with mold? Well, coffee has the highest level of mold of almost all foods out there. So if you are a coffee drinker and you're having a lot of IBS, gas, cramping type of symptoms, you got to cut it out. Cut it out for 2 to 3 weeks and just see the difference that will make for you. But as you can see, when I was drinking 2 to 4 cups of coffee a day, I should be under 37 on this mycophenolic acid. I was up to 143. So that is just a huge immune system trigger for my digestive system. And my body, I basically was having diarrhea because my body was saying, let's get this mold, let's get this mycotoxin out of here. So my body was doing what it was supposed to be doing. I just wasn't listening. So I had to make those proper adjustments to get rid of those root cause issues of my symptoms. I also did another test called an organic acid test. I sometimes do these on patients, but this is just a good one for me to show you the difference before and after treatment. So we have these malabsorption markers. So these are associated with leaky gut. Here's those bacteria markers and the yeast markers. So basically, the bacteria and yeast will produce basically like waste byproducts, and we can measure those in the urine, and that's what these are. So we can measure how much bacteria or yeast is in the system just by how much byproduct exhaust, if you will, those are putting off. So you can see I had a severe bacterial overgrowth all the way out here to 8. I had a little bit of a malabsorption issue going on at 0.1, and down here I had a borderline red yeast marker at 5.2. So just think of this one here first, 8. I'm going to show you what we did after treatment. This was only about six weeks after treatment. We went from 8 to 0.5, so a huge difference. I was way down here on this end, and we came all the way back up to 0.5. Then we were at 0.1 here on the malabsorption, and we improved to 0.04, so a nice improvement there. And look at this other bacteria marker, this uric acid. I originally started at 273. I just want to show you the difference. This wasn't even in the red, but I was at 273 and then went to below detectable limits. So massive improvements there. Then finally, this yeast marker was at 5.2 and it improved to 2.9. So everything was improving and doing well on my labs. So basically, this is how I regained my health. So JVT, James Vincent Taylor, that's me. I just reframed my intention around eating. I was just focusing on that, trying to be less stressed, just relax a little bit, have a little fun before meal times, just aligning my diet, meal timing, and digestion. I used multivitamins, especially with a higher level of zinc for the digestive system. use digestive enzymes to help improve digestion as I was healing. I don't take them anymore. And we had to fix my gut. So I had to get rid of that mold. I had to get rid of that bacterial overgrowth. And then I just created a maintenance plan for long-term results. So I don't deal with that stuff anymore. But if I drink coffee or if I eat a food that I'm sensitive to, I absolutely do feel it. So it's one of those things I just got to choose health over, maybe something I really want to crave that day. And again, just eliminated food sensitivities. So after doing all that, everything just clears up. So if you get to the root cause issue, your symptoms are just going to dissipate. Obviously, I don't have any more digestive challenges. The blue funk's gone. I'm motivated, excited to get going. Energy returns, feel up refreshed. Acne, goes away. My joint pain went away. And I'm just giving this talk now, and that's why I talked about in the very beginning of this webinar. Is just I want to help you feel better, and there are solutions, there are answers. You don't have to feel like crap. You don't have to have the digestive symptoms or even the systemic symptoms either. You just got to have the right testing and the right roadmap to get there. So let's look at these 6 overlooked causes here, and just think about real quick how many of these were affecting my digestion. And many of these were the low digestive enzymes, the sensitivities, the stealth infections. All those were playing factors. So let's look at another case study. So this was a 31-year-old female suffering from fatigue, psoriasis, anxiety, acid reflux, gas, and brain fog. Let's look at some of her labs. So as you can see here, she had a high cow's milk, not in red, but she's getting into the yellow. But here's the kicker, and this is why I love food sensitivity testing. Her highest one was pineapple. I mean, seriously, think about that. Pineapple, it's a fruit. Usually you think fruits and vegetables are safe. They're not. For some people, it can create havoc on the digestive system, and other people it's incredibly nourishing. You could say the same thing about wheat or gluten. Some people can absolutely tolerate it and it's nourishing and their body loves it, and other people it creates Hashimoto's. It just depends on the person. Everyone's unique and different. That's why testing is so important. Egg whites were pretty high, not to the red, not as high as pineapple, but it was definitely up to the yellow. She did have an H. pylori infection, so a lot of her past acid reflux was attributed to that H. pylori infection. So this is part of that GI map, part of the stool analysis we do with patients. Here's another section of it. I just want to show you the dysbiosis, or just kind of altered bacterial overgrowth going on there. So a couple of them were a little high, a couple were a little low. So we did a mold test on her, and we suspected it off of her health history. So in my comprehensive health history packet, I have a whole page, about 40 questions revolved around mold illness. So that's another difference between functional medicine and conventional. Just the health history is completely different. But we suspected mold, and we were right. So we had ochratoxin high, this penicillium species. I'm not even going to try to say it. If we go on to the next one, this one's another coffee one. I see this a lot with people that drink a lot of coffee, is that mold right there. So again, wreaks havoc on the immune system in the gut and creates a lot of inflammation in the gut. So basically, we cleared all those things up. We got rid of her food sensitivities. We cleaned up the H. pylori infection, got rid of the mold, got her off coffee, and basically everything cleared up. Fatigue went away, her psoriasis went away, anxiety went away, acid reflux went away, gas is gone, and brain fog is gone. I just want to show you this quick email. We were talking about supplements one day. You see, we were talking about supplements and magnesium. I blacked out the stuff before that, but I just wanted to show you what she put in there. She just says, "Hey, I'm pretty sure my psoriasis is gone." I mean, how cool is that? I mean, that's consider an autoimmune condition, and just within 3 months, it's gone. Don't have to do anything but get to the root cause issue of what's going on. So again, what was playing in her case between the digestive sequencing, attention, low digestive enzymes, food sensitivities, leaky gut, and these stealth infections. So you can see how these different factors play in differently for different people, but lots of times they'll produce the same symptoms. Let's do just one more. So this is our last one. We have another case study. This is an 11-year-old female, eczema, constipation, bloating, gas, and a lot of abdominal cramps and pain. Mom took her daughter to different specialists, different doctors, and obviously they're not doing anything for her. So we start our testing. Again, start with the food sensitivity testing, and this one's a little different. And this is just to kind of before we get to the stool analysis, this patient actually has leaky gut, so I want you to keep that in mind of what a food sensitivity panel looks like for someone that has leaky gut. So again, this is an 11-year-old female, so overall things should be pretty good. But you can see a lot of dairy products increases inflammation within her GI system. And then we move to fruits. She has these different fruits, 4 or 5 fruits that are starting to kind of creep up. I want you to think about that. Again, here, gliadin wasn't too bad, so fruits were just as inflammatory as gluten. Then here, we have grains here. Wheat gluten is kind of creeping up. Crab, shrimp, hazelnut, and sunflower seed. And let's move to some vegetables, and we have all these different vegetables starting to creep up. So when you have multiple foods from multiple food groups that are creeping up, nothing's in red, but that's a red flag. That's like, ooh, something's going on here. It's normal for someone that has symptoms to maybe have 2 or 3 sensitivities that doesn't have leaky gut. But if someone has leaky gut and we get a food sensitivity panel back, and usually it looks like this. Same thing, we reviewed her mycotoxin page on our health history, suspected mold, and again, we were right. A lot of ochratoxin, this penicillium species. So ochratoxin is usually a water damaged building. It could be a kitchen or a flood, sometimes crawl spaces as well. So we have to really investigate when we find this to see, hey, is this a past exposure or is this something currently going on? So we have some homework to do for sure. So we did the GI map. As you can see, she has a lot of low normal bacteria. So probiotics is definitely something that she needs to do. And then we have a lot of opportunistic bacteria that are high. So similar to my GI map, but kind of the red flag with her is there are certain bacteria that are autoimmune triggers. So it's proven, it's in the research that certain bacteria can cause rheumatoid arthritis, can cause Hashimoto's, can cause MS. Psoriasis, all those. So when definitely someone this young has this bad of a gut, we got to do something about it. And as you can see down here, her candida, she had a yeast overgrowth as well, which is a very big predictor to Hashimoto's for some patients. Some patients that have a high candida, it's a very similar molecular structure to the thyroid gland, so they end up developing Hashimoto's because they have a yeast overgrowth. Then finally, on her intestinal health, she has a low immune response, which is not too uncommon for someone that has that many stealth pathogens living inside of her. She has a lot of inflammation, and calprotectin is a big one, definitely associated with the inflammatory bowel diseases. So, she might be diagnosed with, Crohn's or ulcerative colitis down the road. And here's the leaky gut marker. So zonulin, 244, very high. And that's the reason why her food sensitivity spiked so many different foods. It's because those gap junctions were opened up, so food was being allowed into the bloodstream of this patient. So we did some treatment. So we did a couple months of botanical natural treatment. We did some very high quality probiotics. As you can see, things are balancing out here. This was the before. This is the after. As you can see, this one dipped down a little bit, this Clostridia, but all these other ones, returned to normal. So that's nice to see. This was a huge one. So all these improved, even the ones that are still in red, these all improved. But the big ones are the arrows. So these are all very high on the previous ones. So definitely these autoimmune triggers, all these autoimmune triggers went away, which is fantastic. So we just decreased the risk of her developing an autoimmune disease later. So great results on that. And finally, her immune system's still the same, so we're still working on that. But as you can see, her calprotectin, man, that went down to 1. So that's huge. And then we use natural medicine, herbs, botanicals, nutraceuticals, that kind of thing. And if you remember, her zonulin was 244 and dropped all the way down to 63. And, that happened in under 3 months of treatment. So that was fantastic. Great response. So again, just how she regained her health, just eliminated food sensitivities, replenished missing nutrients. We eliminated those gut infections, mold, and rebalanced the microbiome. And then again, just created a maintenance plan for long-term results. Finally, she doesn't have any digestive challenges anymore, no gas, bloating, constipation, the abdominal pain went away. Her eczema is 75% better and continues to get better, and her sleep actually is improved as well. And again, these 6 overlooked causes of digestive disorders, how many of these, factored into your case? Quite a few. But here's the reality. New and valuable information won't change your life. We're in the realm of just a plethora of information. You could spend hours and years and decades of just research, research, research. The truth of the matter is, all the information we need is already right here. What we need to do is make new decisions and actions to do so. Otherwise, nothing will change. You can research till the cows come home and nothing's going to happen. So I want to show you a video. So this video was created by the Canadian Heart and Stroke Foundations. And just when you're thinking about actions and taking a step forward and actually doing something about your health goal, I love this video. Again, I didn't create it. It was created by the Canadian Heart and Stroke Foundation. But really this talks to 95% of us of, the goals and visions of having a healthy lifestyle. So let's just take a look at this real fast.
What will your last 10 years look like? Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every moment? Will you grow old with vitality? Or get old with disease? It's time to decide. The average Canadian will spend their last 10 years in sickness.
So I hope now you see why it's important to get to the root cause of your symptoms, why changing your diet is not always enough, why doing the right testing is critically important, and why you can never fix a digestive condition with just medications alone, why the current approach is failing so many people, and why personalized healthcare is the only solution. So let's talk about our functional medicine program real fast as we wrap this up. So our functional medicine program, what we do is we connect all the dots instead of just creating more confusion is what happens when we just start doing research. We basically put a brakes on that, we come up with a plan, and we move forward and we heal quickly. We get to the root cause from biochemical, emotional, and from an environmental perspective. So we have to look at a holistic approach at a person. We use state-of-the-art lab testing to really find these hidden issues going on with the person. And finally, we teach you a life skill that you can pass on for generations. So our program's a partnership with patients. Each program's customized to the individual. Some people are very aggressive and want to move fast with lifestyle modifications. Others like to move slow. We have 4 comprehensive appointments in the program and 6 personalized visits with our health and wellness coach that covers nutrition, stress, and exercise. The first appointment is where we get your story. Where have you been? Who have you seen? What are your goals? We collect information from other doctors to see what labs have been run, to see what they have overlooked. Remember, conventionally trained doctors look for disease or pathology. We don't look for pathology. We look for optimal function within the entire system. Then we look at why that system is breaking down. From there, we determine which lab tests need to be ordered to uncover root cause issues in your health. Our next appointment is referred to as the anti-supplement appointment. This is another appointment where we look at your lifestyle. We look at nutrition, positive self-talk, emotions, sleeping patterns, exercise patterns, detox, sun exposure, and water consumption. These are what I consider the pillars of health. If you don't get these right, you don't have a chance at healing, whether it's with medications or supplements. We have to get this right, and we partner with you to make the appropriate changes in your life. Once we get all your labs back in about 3 to 4 weeks, we review those to determine what supplementation or medication you may need to restore optimal function back to the body. We keep communicating via email to help you through the process. We know change isn't easy. Finally, have a 4th appointment. This is usually a great appointment. Within 3 months, if people made the proper lifestyle changes coupled with the appropriate supplements, they are feeling great. It's not uncommon for patients to tell me that functional medicine saved their life. So I hope you can see why we get great results. And then we also do a couple of follow-up appointments with our health and wellness coach, like I said before, and with myself going forward. So just a line item of our functional medicine program. So we do, if you're dealing with digestive disorders, we do food sensitivity and GI map right off the bat. So that's part of the program. We do, we give you the functional medicine solutions handbook. So it's a 50-page manual going through all those different lifestyle factors. We do a review of health history. We have those 4 personalized clinical sessions with myself. And then we have 6 personalized health and wellness coach sessions with Kelly Bridwell. So we come up with a customized supplement and nutrition program. We have what's called Well World. It's a way to track basically your daily lifestyle habits. And I have an online supplement dispensary that you'll have access to. We do interpretation of your labs. And if we need to do additional lab testing going further, they're all at direct lab cost, nothing's marked up. And then we just have direct email access with me and the team. So first step, let's just get started with the discovery call. So this is completely free. So this is a 15-minute block out of my time to just ask me questions to see if this type of program would be right for you. All I ask is that if you carve 15 minutes out of my schedule, please carve 15 minutes out of your schedule and just be ready to take action going forward after that. So we have a no pressure guarantee. So we're only committed to working with patients that really value their health, their time, and our expertise. It is possible for us to help every single one of you, but we never pressure anyone to get healthy. The quest for better health starts as an inner journey and must be a decision you make for yourself. So it starts with you. So some just frequently asked questions. Can we work with people remotely? Yes, absolutely. So a third of my practice, like I said before, is actually doing virtual. I work with patients all over the country. A third of the time I'm here in the clinic, brick and mortar, and a third of my time I'm trying to educate and just run the clinic. How do I know if you can help me? Well, part of that is part of that 15-minute conversation that we have. We really determine if this is something right for you. But generally speaking, if you've been specialist to specialist, doctor to doctor with no answers, we probably can help you. And that's typically what we see. People have exhausted all their options. They're ready for something different. They actually want to get to the root cause. So they give us a call and we have great results. Can I just do the testing? We do have 4 program options. The one I just showed you is the most common one. So we have a couple of options a little less involved in that. And we actually have an option that's a little more involved in that. So we'll review all those on a phone consultation. And how much is the testing? And that one just is variable. So that's person to person. You know, it can be anywhere from $100 up to a few $100. So it just depends on what we're testing and what we're going after. So your next steps for booking an appointment, you should see a link next to this webinar. You can go directly into my calendar and you can book yourself a 15-minute appointment. Kelly will reach out to you to verify everything, make sure everything's good, and then we will hook up for that 15 minutes and just discuss your case, your goals, where you've been, that kind of thing. Just determines this is the right fit for you. Again, no pressure guarantee, but that is your next step to book a 15-minute appointment. And I just want to thank you for joining me. I really wish you great health. And remember, you can feel better. There is a reason why you have digestive symptoms and you can fix it. You just need the right testing and the right path to get there. So again, thank you for joining me and we'll see you next time. Thanks.